Hello. Welcome to Healthy by Choice, the podcast that's here to ignite your belief in what's truly possible for your health and well-being. Hi, I'm Dr. Kerry, and what lights me up is empowering others. My mission has always been to inspire you to take your health seriously and give you the tools to understand your body on a deeper, more meaningful level. In each episode, we'll explore the healing power of nature, the role of real food as medicine, and how intentional movement can restore balance to your body and mind. So whether you're on a journey of prevention, recovery, or simply seeking more vitality, this podcast is your reminder. You hold the power to heal. Thanks so much for joining me. Hi friends, welcome back. Hey, last time I talked about life hacks and tips and tricks, and this time I want to do a follow-up, basically more and add to that. Of course, there are cautions we need to think about, there are contraindications, and then of course side effects. So some things don't apply to all people is essentially the thing. And always check, be cautious, and use ChatGPT or Google or whatever it is that you choose to use and just type in contraindications for, and then the thing that you're considering using that may have otherwise been considered a natural product, or side effects for or of, and then type it in. And I'll give you some examples, and that could be medications are going to have contraindications with some of the natural things. So always, I would actually recommend once a year, take anything that you consume regularly and type in side effects for, particularly if you're having any symptoms, any headaches, any body aches, anything like not sleeping well, and particularly if you used to be a great sleeper and now you're not sleeping well, or if you're feeling extra sleepy. And then there's always the weight gain and the weight loss, and people are always looking for reasons. It can often be the medications that you're taking and or the combination of medications that you're taking. But also, it can be things that we believe to be healthy and find out later that it's not great for us. I'll give you a quick synopsis of what I was going through recently. I went through my weight loss journey, and I've lost and kept off weight, and I was having this issue where I'm like, but I still get bloated when I eat. And then I checked in with the FODMAP diet, FODMAP, FODMAP, and it's basically how one's body processes sugars, and I know that I'm sensitive to sugars. And would you believe, after all the finding out why not to eat iceberg lettuce because it will tear up your stomach, and all kinds of things that I've been learning just really recently at 55 years old. But this year I discovered that I can't have apples, particularly a full apple on an empty stomach. And that's one of the things in the last 3 years I have been having an apple a day. It was, for whatever reason, my chosen fruit. One time per day I had a snack, and I was purchasing about 6 or 7 per week, and I was eating about 6 or 7 per week over the last several years, and my tummy was hurting. And I checked it out. I do an elimination diet, and it was, for me, apples. So as an example, anybody would tell you an apple is a healthy thing. Anybody would tell you, getting an organic, non-GMO apple, anybody, and then my tummy hurts when I eat it. So that's a personal example. Another thing, so the last episode really brought on probably the most conversations about my podcasts that I've had so far. And I've had some really interesting and great conversations with people having recommendations to share some tips and tricks, some life hacks or biohacks, which I love. And one of the really important things that came up is, a lot of us think essential oils are amazing, and I use essential oils really regularly. And in my clinics. Each clinic, sometimes the lady that I share with will turn on the diffuser and diffuse oils, and sometimes I will, and sometimes we have them for, all kinds of things. And if you remember, I recommended lavender oil for several things, from burns to ear pain. And one of the most common things people brought to me is, lavender is not for everybody. And a lot of pregnant women know that, or women who have been pregnant recently know that it is not recommended always for women who are pregnant. Of course, it's your body, you get to decide, but if you're trying to not take chances, let it be known that they say to avoid using during your first trimester, particularly if you have a history of miscarriage. And that's one of those things where I think it's also related to people on blood thinners should not use lavender oil. So there you have it. But my thing that I wanted to focus on is kids. Remember how I was saying I take a cotton ball, put lavender on the cotton ball, and I'll hold it behind my ear. And it was pointed out to me that repeated topical application has been linked to gynecomastia, which is the abnormal breast growth in prepubescent boys. Now, I don't know how often or how many times a person would use lavender oil on their body, but it's important to know all things, even good for you, quotes, good for you things, can have side effects. And lavender oil isn't something that you would use so often or so much of, but to just know that there are lists and lists of drug interactions, particularly people on blood thinners or people on antidepressants or sedatives, etc., etc. So just to remind you, everything you use, whether it is a pharmaceutical, even if it was prescribed to you by a medical doctor, and if you have any combination of medicines, always just type it in, this with this, or is this contraindicated to that, or the cautions of, and then type in the word. Another thing about essential oils is animals. So if you have animals in the house, it's important to realize that if you're diffusing the oils, a dog or a cat can't discern for themselves whether or not they should walk away. And there are lists, of course, everywhere of which essential oils to avoid if you have a dog or a cat. Usually we don't put them directly on the dog or, anything like that. But there are also safe ones, right? There's safe essential oils that you can use for your animals. Please consider looking those up. Most of them are the strong ones, cinnamon, clove. But you know what? You know which animals you have, and you know that you don't want to hurt your animals, particularly by diffusing oil or rubbing it on them. So check. The thing to remember is that the definition of the word contraindication is that it suggests or indicates that a particular technique or drug should not be used in the case in question. And that's what I think is the most important, because of course, if you have an allergy, which is one of the things I find the most funny about any medication or any product that we purchase, it says, if you have an allergy to this product, don't use it. Well, okay. And if it's contraindicated in anything else that you're doing or anything else with anything else that you're using, and just always to consider that there are side effects. One example is magnesium supplements. There are people who have headaches, and I mean migraines, suffering, no other way to handle it, or cramping, whether it's in their feet, or unable to sleep, or digestive tract issues. And the only thing that helps is magnesium, in particular magnesium supplements, which there are like 7 different kinds of magnesium. However, also they can be contraindicated with medications. I know that for sure antibiotics and some of the blood pressure medications are contraindicated with supplements. So it's a perfect example of there are things that can be plenty good for you, but they may interact with other supplements or medications that you're taking. I have long been a proponent of multivitamin. In fact, it's one of those things that changed my life the most. And there are contraindications. People who take blood thinners or diuretics oftentimes are told not to take certain multivitamins. So be sure to check what you are taking and maybe even look into the list of ingredients and see whether or not there are things in those ingredients that are going to be sensitive or cause sensitivity to other things in your cabinet. Also, many of us who want to keep our inflammation down and keep our joints lubricated will take essential fatty acids or fish oil supplement and get great results. So of course we walk around telling everyone that they should do it. Clearly, if you have a fish allergy, do not take a fish oil supplement because they're made from fish. And it seems obvious. And then you find out, people who have blood thinning medications like even people who take an aspirin are not supposed to take those because they're at a risk of bleeding or bleeding out. And I'm like, oh, well, that's a bummer because it does what it's supposed to do, but those medications are already increasing the risk of bleeding. So it is one of those things where everything that we do, we should consider what we're already doing or what we want to do together as interactions. For me, the best ever tip and trick to get pain out of my body is to have no sugar. And that's one of those things where you don't take anything. You don't do anything. You undo. In my case, I had to come to terms with the fact that when I have pain in my spine or actual back pain, it means I've been eating sugar. And sometimes drinking alcohol is the exact same thing, by the way, as eating sugar because alcohol turns to sugar in the body. So the liver processes alcohol, sugar, alcohol. And it's one of those things. Take the cause out, stop causing the pain. So a few more fun facts. I would say if you do have trouble sleeping, make sure that you do have enough calcium and magnesium. A lot of people will say melatonin, which yes, that's also true. And then sleeping in a dark room, no screens for an hour before bedtime. You want to brush your teeth, wash your face, and do all that stuff kind of in the dark. Get your brain going down, down, down. Think about little kids. Right after dinner is bath time, story time. There's a whole winding down period that happens. It doesn't just switch to off. And hopefully you can see how bringing attention to your brain, your thinker, all the stuff, even activity, physical activity, and then telling your brain go lay down and go to sleep is not the way to do that. It's much healthier, much more loving to oneself to go in stages. Even walk into your room and pull down your bed sheets, make the room ready, turn down the lights, then go brush your teeth, wash your face, all not using your phone. And if you read, try to read a book, a hard book as opposed to on a screen. And, there's all these things that we're doing these days that we're getting so much input. So take the input away, including noises and sights and sounds, and then make sure that you have a good magnesium, calcium supplement or enough in your system. And I know that a lot of people will say that drinking water is frightening to them because they don't want to have to pee at night. But when you're dehydrated, you're going to wake up too and cramp as well. So make sure that during the morning hours and daytime hours, you're getting plenty of water, and then hopefully you're peeing during the day. And I know that it can be a super bummer to wake up in the middle of the night. And I know it can be the worst of all if you can't fall back to sleep. And cramping I have no tolerance for cramping whatsoever. I always believe that cramping is nutritional. So I'm certain that I get enough water every day. I track my water every day, and I stay on top of my supplements, mostly electrolytes. That magnesium and magnesium potassium pump and all that really matters, and I am not wanting to be waking up in the middle of the night with a cramp. So I have no tolerance for that. And I wish that for you too. That's just mean. That's just the body bullying you. When you add that to, remember what we talked about last time, is having the weight from an eye pillow on your eyes, that will increase the rest and digest. So if you have an eye pillow or get an eye pillow or make or create an eye pillow, or just put the weight of a dime on your eyelids, right? So you just close your eyes, touch your eyelids, breathe. It's a perfect opportunity to increase your breathing, meditation, calming, and it does help you sleep better. It really transitions your brain and your entire body into sleep. I know a lot of people need some sleep tips and tricks, and breathing well also. So using those nose strips or nasal strips or nasal expanders so that you can get breath in and out. Again, we talked about this the last time you and I were chatting. We talked about this in the last episode because the nasal expanders really do open up the channel so that your brain can get the nitric oxide that it needs, and so that your entire body can calm down. So again, a tiger would not be chasing you, right? If you have a calm breath, you know that you can go into rest and digest, and you know that it's time for sleep. It is not time to be calculating math or doing your taxes or imagining all the things that are the equivalent of a tiger chasing you on your nervous system. So that's the whole point of having the sympathetic nervous system, so that when it is time, it can kick into gear, it can handle business, and sleeping is not that time. So just make yourself ready. I know that people love to read crazy novels about crazy things, and I've heard so many of these podcasts that people listen to that, yes, I understand they're very exciting and suspenseful, but maybe not before bed, just to remind you that does get your brain going, and that does, once your brain is going, it wakes you up. So we want to not do that before bedtime. Just love yourself into a wonderful routine that tells yourself it's sleep time now, just like it's digestion time now. They say very similar things about eating, right? So no screens, not listening to anything exciting, particularly the news, even TV shows. You don't want to do anything else when you're digesting. Even reading can be included in that, but the people who are standing at the table or standing at the countertop are not putting themselves in the position to digest their food. So we were just not designed to do two things at once. And I describe it as we're giving our bodies a confused message. We're telling our brain, I want you to use all your blood in my legs to stand up, walk around, or I want you to use that excitement level, right? Those excitatory responses. So I'm feeding you this information from the show that I'm watching or the book that I'm reading or the conversation that I'm having that's engaging. However, it's time to digest. It's time to give ourselves, same thing with sleep. It's time to give ourselves the opportunity to do the best we can with the way that we were already designed to be. So those are some tips and tricks. Remember to check in with your cautions, your contraindications, your side effects. And with that, know that I love you. I'm sending all my very best, and I truly appreciate you. Take really good care.